Hi, today I'm going to talk about breathing and COVID vaccines. This topic is somewhat depressing, and that's why I decided to do this video in this beautiful place. I'm not in Hawaii. I'm in Colorado, in the greenhouse of the Breathing Center's office. It is actually a cold day today, and the wind is howling outside. Keep my fingers crossed that it doesn't disturb this video. So, the vaccine. Many people need to make a difficult decision whether to take the vaccine or not. Unfortunately, it's a bit like gambling. If you don't take the vaccine, you are at risk of being seriously affected by COVID. If you do, you might experience other health problems, the side effects of this somewhat experimental medicine. I believe that the decision to take vaccine or not is individual. The goal of this video is not to influence your decision, but to help you to stay healthy, no matter what you decide. First, I'd like to remind everyone that the best protection from any virus is a strong immune system, which is, according to Dr. Buteyko, is indicated by positive maximum pause of 60 seconds. Do you know how to take your positive maximum pause, how to check your CO2 level? If not, please visit the breathing test page on the Breathing Center's website. But here I briefly explain how to do it. If it is effortless for you to stop breathing for 60 seconds after a gentle exhale, your immune system is strong and COVID is not going to affect you. Or if it does, it's going to be very mild. If after a gentle exhale, you're comfortable staying without air only for 5, 10, or 15 seconds, then your immune system is weak. And unfortunately, this situation is very common. Most people, especially elders, experience a lack of CO2. In this case, COVID represents a serious risk. However, the vaccine also could negatively affect breathing and health of this person. And I'm saying this from my experience. Several of my clients took the vaccine while doing our breathing normalization course when they take breathing measurements every day. Their measurements indicated that the vaccine lowered their positive maximum pulses, and they did not feel well because of it. Their primary symptoms, whether it was breathing difficulties or anxiety, became more active during this time. So I recommended them to do more breathing exercises to increase their CO2 level fast. And this helped them to overcome the side effects of vaccination. If you decide to take the vaccine, please keep in mind that most likely it will lower your level of carbon dioxide and possibly trigger some symptoms. Of course, the higher your CO2 level is, the less you will be affected by the vaccine. So in preparation for vaccination, try to gain as much CO2 as possible and prevent its loss. But the same is needed after taking the COVID vaccine, because the higher your positive maximum pulse is, the faster you will recover. Then the question is how to maintain a high level or a normal level of CO2. And of course, the Breathing Center offers various programs to achieve this goal. But here, I will give you some basic recommendations which are suitable for anyone. First of all, try to breathe through your nose only, day and night. Then, avoid unnecessary conversations. Try to spend some time in silence, in fact, as much as possible. And this is important because most people lose their CO2 when they talk. Then stay relaxed. Relaxation increases the CO2 level. If needed, drink some herbal teas supportive of relaxation. Take slow, preferably long walks. And whenever you have a minute, try to increase your CO2 level by humming. So do something as simple as this. All these techniques help to maintain a high level of CO2 and a better immune system function. So I hope they will help you to stay healthy. If you get infected with COVID, I suggest watching our video course created by Fred Brown, Advanced Buteyko Breathing Specialist. Fred is also a registered respiratory therapist who has been working with COVID patients since the very beginning of this disease. In his video course, he gives step-by-step recommendations on how to control breath, whether you are at home or in hospital. And from my perspective, his recommendations are priceless. Thank you for listening. Stay healthy and breathe well.